I'm here today to announce that Ellie Wilson will be our keynote speaker. She's going to come and talk about autism and effective emergency response. Ellie Wilson is the Executive Director of the Autism Society of Minnesota. She's been working to support children, teens, and adults with autism spectrum disorders for 13 years. After pursuing study in public health administration and policy, Ellie completed 2 fellowships, one with Minnesota LEN, the Leadership in Education and Neurodevelopmental Disabilities, and one with the National Institute of Educational Leadership. Ellie has worked to promote autism safety, inclusion, support, and celebration in settings relevant to community living, intervention, recreation, and education. Her specialty is fostering energized, healthy community partnerships to promote the evolution of our inclusive societal landscape for individuals on the spectrum or with other disabilities. Ellie, the stage is yours. Please welcome her.
Okay, I suppose if I keep getting embarrassed by that bio, I should stop writing it to be so long. I have made a decision just now that that will be my future plan. Okay, good morning, everybody. My name is Ellie. I am the Executive Director of a group called the Autism Society of Minnesota. There's 2 things I want you to know about the Autism Society. We go by AWESOME, by the way, AUSM, so when I refer to it as such, it's not just a cute nickname, it's a very convenient acronym. And what I want you to know is the Autism Society serves 2 major purposes related to your lives. The first is that we train people. The training that we're going to do today is meant for a mixed crowd, like yourselves. But if this is information you think is relevant to your colleagues, what we can do is narrow this content so that it's specific to whatever type of work you do. The other thing I want you to know is that the Autism Society of Minnesota is a statewide resource for anybody affected by autism. So many of you approached me at the exhibitor hall yesterday saying, hey, I know somebody on the spectrum. Turns out we all do these days. And if you ever know someone personally or work with clients, patients, students, or anybody that you think needs more support in their lives, I want you to know that they can always call the Autism Society. We do a lot, and if we don't do it, we know somebody else that does it. And our whole purpose is getting people to the resources that work for them, okay? So that's who we are. I also hang with people with autism a lot. And when I hang with people with autism, they love to know what's going to happen next. And I'm going to pay you the same courtesy, okay? This presentation has 2 parts. The first part is talking about autism with a little more depth, because the truth is, even though it's not your job to diagnose autism, and I totally appreciate that, this thing is complex. This spectrum is really wide, and because the spectrum is really wide, your job is harder. So I want to talk a little bit about some of the misconceptions around autism that sometimes trip us up early in the emergency response process. So hopefully we're going to bust a few myths. Hopefully I'll tell you a couple stories that will somehow awaken you from your 8 a.m. commitment here. And then we're going to move into the strategies that I think you can use. The way we've modeled these strategies is essentially from like a dispatch into arriving at a scene, into processing whatever happens at that scene. Now, if that's not exactly relevant for whatever you do, because this is a mixed audience, I appreciate your tolerance for that format. In the meantime, the strategies that I will recommend could be used in any setting. What's really great about these strategies is that they are applicable in absolutely any setting, and part of my job is to help you figure out how to do that. So if that's something we can talk about after, I'm happy to do that for you. All right? Shall we get started? Nice, okay, 8 a.m., woo. Okay, so first of all, why am I here to talk to you about autism? Because there's a hell of a lot of it, all right? When I started graduate school in 2000, I think it was actually 2009 and not 2008, but whatever. The number was 1 in 250. And since that time, we've seen 1 in 250, 1 in 150, 1 in 88, 1 in 68, and as of April of this year, the CDC reports that 1 in 59 people in the United States are affected by autism. Now, in a presentation where I could take questions, this is when all the hands go up. And they say, Ellie, why? Why is this happening? If you care to know, what I'll tell you is that there is more autism than there used to be, and we find it better than we used to find it. So anybody who tells you that it's only one of those things or the other is probably not telling you the whole picture, but the truth is we don't know exactly what is causing the increase in the prevalence of autism. The other thing I want you to know is here in Minnesota, the numbers seem to be a little bit higher. The numbers in Minnesota are actually 1 in 42, which means there's more than 70,000 people in the state of Minnesota who could qualify as being on the spectrum. That doesn't mean they've been diagnosed, but it does mean there's a hell of a lot of people that we want to support. Here's what I want you to know, sort of as statistics. Technically, you are still more likely to interact with a male on the spectrum than a female. People who are really smart about this stuff think that eventually we're going to start diagnosing girls better, and some of that will even out. It happens in all socioeconomic groups, and part of the reason why the prevalence is higher in Minnesota is because of our higher population of refugees. So we find an especially high prevalence of autism in the Somali community and in the Hmong community. But here's the thing, those studies are really early. So I don't want you to go saying that there's like a huge correlation. It's just a pattern worth noting, and the CDC is going to continue to study that. But it's something that I want you to know about. The last thing that's really important to talk about right away is that autism is not a childhood disorder. Most people consider autism, when they picture somebody with autism, they picture like a little white, chubby-cheeked 8-year-old boy, and there are lots of those. But the thing about autism is that it's a developmental disability, which means it affects how your brain develops right from when you're born. And if that's the case, that development affects you for your entire life. Now, you can learn a lot of strategies and do great in your community, but you don't technically outgrow your autism. Okay? So we're talking about children and adults. The other thing I want you to know is that autism often occurs with other types of disabilities. About a third of the time, we're looking at people who have co-occurring seizure disorders. For the medical responders in the room, I want you to know about that statistic. I also want you to know that only about a third of people with autism have a co-occurring intellectual disability, which really is qualified by their IQ. So people have a very wide range of skills and intelligence. The other thing really worth noting is that 75%, and this is the most conservative number I could find, of people on the spectrum have co-occurring anxiety disorders, and you're going to understand why that is in just a moment. Now, when people formally diagnose autism, this is what they're looking at. They're looking at different parts of people's behavior in order to make a diagnosis. We can't test blood, we can't test genes, so we have to test behavior. How many of you have heard of Asperger's disorder before, or pervasive developmental disorder? There are all kinds of words surrounding this label of autism, and some people even like to use words like high functioning versus low functioning. Now, I am not the PC police, okay? I find that it does not help me to engage and train all of you to get really into the semantics. What I will tell you, though, is those high and low functioning labels that often you'll get from family members or supporters that you may encounter in an emergency response situation, that information is typically not useful. And here's why. When we think about autism, this is how I want you to conceptualize this disability. Let me explain how this graph works. I'm a typically developing person. Notice I don't say normal, right? Normal is a setting on a washing machine. Like, nobody in my life would qualify me as normal. And I saw a couple of you at the bar last night, and I know you are not normal. So let's just say we are typically developing, okay? Typically developing people show a line like this green line. We score generally pretty highly across distinct categories of testing. We have some variability. Some of us are better at spatial awareness than verbal skills, or vice versa. But we score in the same area of that graph because our brain developed in a very cohesive way where those skills are interdependent, believe it or not. If I had strictly a developmental disability or a developmental delay that wasn't autism, I would show a pattern like that white line below. More variability, but again, scores falling in a predictable quadrant of the graph. Now, shout out to those people. I love people with disabilities. Guys, this is like my whole life. And what I will tell you is all these tests are timed, and literally the smartest guy I have ever worked with told me that all disability is a function of time. If we can give people enough time to do something, they can do it. But these tests are timed, and that's why people score differently. All right? Now, back to autism. Look at this pattern, or rather lack thereof, in somebody with autism. Somebody with autism is going to have incredible strengths, not necessarily strengths that you can see right out of the gate, but they're going to have strengths beyond that of their neurotypical peers, and they're going to have challenges that are below that of their peers with similar disabilities, and there's going to be no correlation between their skills. This is why it's hard. Like, this is the reason. The way that we all work, especially in emergency response, when it's literally your job to make very quick observations and educated assumptions based on those observations, we fail this kind of person because how we make assumptions about these skills is based on that pattern of a neurotypical person and not necessarily a person with autism. So I want you to look at this particular guy, this red line guy. A high IQ and good language skills usually means that everybody in this guy's life tells him he's high functioning, right? Our really only expectation for high functioning is that you can talk. That's pretty much it. So when you see this, or you see this guy and you say, yeah, he's really high functioning, I want you to look at that dip in the social area. That is a deficit, a challenge, a disability that is going to be with this person for their entire lives. And it's the reason why they're more likely to interact with you than any of their peers. So when someone tells you, oh, this is my son, he has autism, but he's high functioning, I want you to smile and nod and file that information back in the place where you file everything else that's pretty unimportant. Okay, because we can do so much better with our own observation than going with those kinds of labels. Okay, now, even though this spectrum is really wide, there are some core characteristics that I want you to watch out for. Okay, now, the Diagnostic and Statistical Manual, blah, 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 is going to tell you there are 3 things. That's important. I don't disagree with that manual, but I think I've got a better way to explain it to you than that. All right, so I'm going to take you through a couple of things that are a little more easy to relate to. The number one thing you're going to notice about people on the spectrum is they communicate differently. Now, in your conceptualization of autism, you might think, oh yeah, some people with autism don't talk. It's such a small fraction. Only 10%, 15% at tops don't have what we call functional communication, which means maybe they use an assistive communication device, maybe they use sign language, but 85% of people on the spectrum or more are going to talk to you, and they're going to talk a lot, okay? When they talk, here's what I want you to notice. They really have difficulty reading and portraying appropriate nonverbal communication. What do I mean by that? I mean your tone, your gestures, your body language. I work with this guy named Sam. He's delightful in every way. I've worked with him for years. Every single interaction I have ever had with him, he talks like this. Hi, Miss Wilson. And sometimes I come in and I say, hey, Sam, good morning. And he goes, hi, good morning. I am pissed. And I will say, but Sam, your voice, your eyebrows, your general demeanor. And he does not care. At least he told me he's pissed. That's pretty good, actually. So that's what I want you to know is sometimes there's a mismatch in those nonverbal versus those verbal skills. So we have to pay close attention to that. I also want you to know this tendency that people with autism have to repeat language. Now, some people do that thing that's kind of like parroting. That's called echolalia, where we're directly repeating what people have just said. That happens sometimes. What happens more commonly is we've got people repeating language from something they saw somewhere else. Some people call this scripting, okay? If you know somebody with autism, in all likelihood, you have heard them script something before, and here's why. People with autism tend to be able to repeat language better than they can generate language, all right? I used to work with this guy named Xavier. He is hands down my favorite human that I have ever known. Xavier has memorized every single episode of SpongeBob SquarePants that has ever existed. That's like 8,000 episodes. I'd like you all to marinate in that accomplishment for just a minute, okay? Now, Xavier, I don't know if you guys have watched this show before. I can't watch that show because that Sponge's voice is akin to nails on a chalkboard for me. I can't listen to it. But when Xavier says the lines from that show, I realize there's vocabulary, there's social commentary, there's innuendo in that show. It's actually like a pretty smart show. And Xavier understands all of that and will pluck a line from that show and insert it into a conversation. Most people don't know he's doing it, so they think he's out to lunch. But really, he's trying to communicate in a way that's effective. He has so much vocabulary and he understands all of it because of that show. But if I say, hey, Xav, what did you have for lunch today? My friend Xavier, who's incredibly smart, he'll say, for lunch, the kid knows what he had for lunch, okay? But unless he had a Krabby Patty, which would be very convenient, it's very difficult for him to generate even the simplest of sentences, and that trait gets exponentially stronger when someone is under stress, especially in an emergency situation, okay? So when you're hearing those things that just sound like somebody's not paying attention or not engaging with you, I want you to challenge to just make sure, is there any communication here? Because often there is, all right? We're going to talk a little bit about literal thinking also. People with autism do tend to be literal communicators, and we will revisit that in a little bit. The other thing that I think is critically important for you to know, like this is kind of the crux of autism, this is the thing that really differentiates autism from any other disability, is the differences that we see in social development. Now, in a room full of all you people, I wouldn't spend so much time talking about this if I thought that social development was just about making friends, right? People talk about social differences and they say, oh yeah, kids with autism, they have a hard time making friends. And like, it's just a little reductive. We use so many social skills every day. A lot of those skills are things like give and take conversation. You may be trying to truly accomplish something when you're interacting with somebody on the spectrum, and they may not respond to you in the way that you would predict. That's not like a rudeness, that tends to be a social unawareness. The thing I want you to know about this, the call and response thing. If I come into a room and somebody goes, Ellie, I immediately begin looking around for who, it literally happened like 8 minutes ago, right? You look around for who said your name. That's a social expectation. Many people with autism, for instance, if they're lost or if there's some sort of emergency and you're calling out to them by their name, they may not know to answer. So sometimes we have to be a little creative in our techniques of trying to find someone other than just using their name. You may have better luck, just walking around talking about Spider-Man. That may engage someone better than just saying their name. That's really tricky, and we're going to talk about that level of individualization at the very end of the presentation. It's something I want you to know about. I also want you to know people with autism often have unusual eye contact. I didn't put no eye contact, I put unusual eye contact. Here's the thing I want you to know about this, okay? It doesn't matter. I work with so many people on the spectrum who say, Ellie, I can listen to you or I can look at you, but I cannot do both. And unless you need to literally check their pupils, there is no reason why they need to be looking at you. So I want you to reinforce, thank you for listening to me, as opposed to you need to look at me, all right? Theory of mind is a social skill. Theory of mind is essentially our ability to take the perspective of another person. We're not going to get into this today, although I love this conversation. It's not the same as empathy. It's that fundamental social skill of understanding you have a different mind than I have. You have different experiences, different memories, different preferences, and all of those things are a product of whatever your experiences have been. People who have low theory of mind have a really difficult time with this. And why it comes up in emergency response is people who elope, people who wander. Sometimes they're truly trying to escape something, and we'll talk about that in a little bit. Sometimes they literally don't know that you can't find them, because if they know where they are, why don't you know where they are? Right? That fundamental understanding that like you don't have all the same information that I have. If I didn't tell you where I'm going, you wouldn't know. That lack of theory of mind is what leads a lot of people into those dangerous positions. Okay, but most importantly, if you remember nothing else from this presentation, I want you to remember this. People with autism have a very difficult time looking around at their surroundings and modeling their behavior based on what's happening. Okay? That is the skill that truly causes a lot of the social unawareness. And if you think this is unimportant, I'm going to prove to you that it is. This is also just my special treat for all of you 8 a.m. early birds. We're going to play the urinal game, all right? Now, if you perhaps, have 2 X chromosomes and haven't used a urinal that you would ever admit to everybody, you're allowed to just bypass this activity and listen to your counterparts. I I'm certainly not going to admit that I have ever been in a urinal situation, so let's ask the gentleman. Guys, if you walk into a public bathroom and there are 6 urinals against the wall, all right? Let's assume equidistant doors and like all that. Don't try to screw this up, okay? If there are 6 urinals against the wall, and there is a guy at urinal 2 and a guy at urinal 4, as in this situation A, right? So the open ones are 1, 3, 5, and 6. Gentlemen, which one are you gonna choose? 6. Thank you for your participation, okay? Here's a slightly more advanced question. In case B, there's somebody at 2, 4, and 6. Gentlemen, which one are you gonna use? 1, thank you. Finally, if there's somebody at 1, 2, 3, 5, and 6, which one are you gonna use, guys? I'll wait. This is so satisfying because you're such a large crowd. This really creates quite an impression. But I will tell you, every single time I have done this presentation, and it's a lot of times, it's 6, 1, we wait. And then somebody makes a joke about the Metrodome. Did anybody do that at their table? It's like, yo, remember the trough? That's the pattern that happens every single time. So let me tell you, this must be a rule. There is no way that all of you very polite listeners are compelled to participate at exactly the same moment if you're not confident in the answer to this finite question. That means there is a rule here. So here is my $1 million follow-up question, and I mean it. Who taught this to you? Anybody? Were there flashcards involved? You know, your male relatives gathered around for some sort of special weekend where you practice this? I bet there's not a person in this room that knows how they learned this in any finite sense. That's because the way we learn everything is to try until we fail and to adjust our behavior based on the reactions of other people. And if you're on the autism spectrum, those cues are not available to you. You can learn to use those cues over much time, but it's a fundamental difference in how people process. And here's what's tricky about this. Rules change. If a 5-year-old pulls up to urinal 3 in the first situation and drops his pants to his ankles and starts whistling Gilligan's Island, like, that's funny. But that 5-year-old is gonna turn 6 and later 10 and 12 and 31, and like, if he's any of those ages, that's not funny. Right? It's only funnier when he's 5. So we really have to think about, this is why. This is a really big part of why people on the spectrum interact with you, emergency responders and law enforcement, so much more commonly than their peers. Okay? The next trait I want you to know about is repetitive behavior. People on the spectrum, they talk about the same stuff, they fixate on their routines, they have a lot of difficulty with new situations because they have trouble generalizing from what they have experienced before, and they often participate in physical repetitive behavior. Now, some people flap, some people rock, some people pace. You can't always see it all the time, but usually there's some sort of physical behavior that you can observe, and it's likely to get stronger in stressful situations. What I want you to know is that behavior has a purpose, and that purpose is often a form of regulation. Either it's giving them some sort of stimulation that they need, or it's almost like blocking out other things that are happening so that they can regulate, all right? If we can allow those things to happen, if it's safe, if it's acceptable for someone to pace or rock or flap while you're engaging with them, that's a good thing to let them continue to do, okay? If you can't, if that's not something you can accommodate, then fine. I'm not here to tell you to do dangerous things. I'm here to tell you that if we can afford to do this, it will lead to better outcomes for your interactions with somebody on the spectrum, okay? Now, another couple of traits I want you to know about, these ones aren't in that core DSM, but I think they are really important for you to know. People with autism often have something called low executive function. This is not the same as intelligence. Einstein was actually said to have the lowest executive function of anyone in the college where he taught. Executive function is essentially your ability to multitask. It's a little more complicated than that, but let's just, for the purpose of the presentation, say Executive function is your ability to do multiple things at a time in a way that's sort of cohesive. And if you have trouble with executive function, you have a real problem understanding time, because timing is often what coordinates all those things, and if you have a poor sense of time, you don't have great executive function. Understanding the steps of a process as simple as washing your hands actually has like 10 different steps, and somebody on the autism spectrum might not be able to put those steps in sequence, okay? And then finally, transitioning from one thing to the next. The introduction of a new face, a new place, a new experience, and the change from each of those things causes almost like a processing freeze for a lot of people on the spectrum, okay? We're gonna talk about strategies for that when we get to the back half of this. This one people love to talk about, I think because it's really relatable. Many people with autism process sensory information in a different way. Now, when I was, younger, I basically looked exactly the same, only I was shorter, just picture it with me. I learned from a very large yellow bird that we had 5 senses, okay? I don't know if you learned the same thing. Turns out that bird is misinformed, okay? You have 8 different senses, the 5 that you know. Then you have your vestibular sense, which is your sense of balance. For those of you who can't sit in a 4-legged chair without leaning back on the back 2 legs of that chair, your vestibular sense is your sense that goes like, huh, right before that chair tips. That thing that makes you like lurch forward, that's your vestibular sense, okay? Your proprioceptive sense, this is the largest word I use on a daily basis, I'm very proud of it. Your proprioceptive sense is your sense of body positioning. I bet you're not all thinking about it, but now that I mention it, can you all feel yourselves sitting in your chair? Can you feel the weight of yourself, your butt in your seat? That's your proprioceptive sense, acknowledging the position of your body, and like it manages that body position based on your weight distribution. That same mechanism is the mechanism that helps you understand pressure. Okay, we're gonna talk about this. This is a super important one. Deep pressure for people with autism. But the one last sense I want you to know about is new. This is hot off the press. Your 8th sense is called your interoception. It's how you take cues from within. So what does it feel like to feel hungry, anxious, tired, cold? Some of those things you're receiving, cold's kind of a bad example, whoops. Somebody put that on the evaluation. But the first 3, those are things that you feel from within, okay? That's your interoception. Now, any of these 8 senses can be processed differently in somebody on the spectrum. Half the time we've got people who are hypersensitive. Things are too stimulating. So lights are too bright, or sounds are too loud. This is like the classic autistic posture, right? That's hypersensitivity. Hyposensitivity happens so much more often. Hyposensitivity is I'm sensory seeking. I need more of that input in order to feel regulated. Now, how many of you have heard before, I want to revisit this idea of proprioception and hyposensitivity. How many of you have heard before that people with autism walk on their tiptoes? This is like one of the screening things. If you have a toddler at home who walks on his tiptoes a lot, somebody might tell you, ask your pediatrician about autism. Well, I want you to think about that. When you walk on your tiptoes, you're essentially putting more of your weight in less of your foot. You're pushing on the ground harder, and that ground is giving you more feedback, okay? That's evidence of that need for pressure. People with autism often, like more than any other profile, more than any other sense, I think so many people on the autism spectrum seek out pressure. And in fact, one of the things I have to tell you about is sometimes that leads to dangerous behaviors. The first is something we call self-injurious behavior. So people who, perhaps you arrive on the scene and somebody has scar tissue around the curve of their hand, or somebody has a lot of bruising, along their femur. That type of high impact, or like biting or things that they're doing to themselves, oftentimes that is a really inappropriate but successful attempt at getting that deep pressure. And so if you're seeing those things, you know right away that somebody is going to benefit from that kind of support. The other thing I want you to know is that the absolute #1 cause of death amongst people with autism is drowning. And the reason for that is, I want you to think about it. When was the last time you were underwater? Can you envision the feeling of just being surrounded by the density of water, by the pressure that you get all around your body as you dive deeper in a pool or in a lake or whatever? That seeking of proprioception, especially when you're really stressed out, is something people with autism do all the time. And so if you ever are responding to an emergency call that's related to missing, elopement or wandering, I want you all to know that the absolute first place you should be checking is the nearest bodies of water. Okay? That's not my favorite statistic to talk about. There's so many horrible stories about that we're not going to go over today, but it is a very real, trend. Okay? Finally, I just want to acknowledge that people process sensory information in a different way. Normally, when we all look at a picture like this, we describe it in its whole. We say things like, yeah, this is commuting in the rain, or this is walking in the rain. Somebody on the spectrum looks at this picture like this: footstep, red stripe, umbrella, raindrop, car horn. And if all of those things are happening in real life, think of the processing time difference it takes to interpret this picture. Funny story, one time I was giving this presentation to some of your buddies somewhere else, and I said to these guys, what would you name this picture? And this one guy in the back yelled out, 11 stripes. And I was like, ooh, backfire. I was like, somebody has got the TISM up in here. Okay, so I just explained a lot of stuff to you, okay? We just went over communication, socialization, repetitive behavior, executive function, sensory processing. Now finally, we get to the point, which is sometimes behavior in people with autism is really challenging. It doesn't have to do with discipline. It doesn't have to necessarily do with their home life. Those aren't correlations that are real. It doesn't mean they don't exist, but that's not a correlation that we can depend on. What we can depend on is that all of those stressors sometimes lead to challenging behavior, especially in an emergency response situation. So what the heck can we do about it? Well, what we can do is first anticipate what are going to send up our red flags when we hear from dispatch. At dispatch, you might just get a general emergency medical response. That's fine, and especially with that co-occurrence of epilepsy or seizure disorders, that's going to be a major reason why you would respond to somebody with autism. You also are going to hear things like, oh, there was this guy who struck up a conversation with a woman about her t-shirt and wouldn't let it drop, and now she's calling because he's stalking her, or something like it. There was somebody at the Target Field Twin Stadium last year who destructed some property because he was trying to plug in his iPad at one of those stations where you can charge things, because the guy couldn't talk. And he used an assistive communication device, and it was about to lose charge. It's his only way of interacting with people. And he, kind of in a fret, unplugged somebody else's phone that got crushed on the ground, and he ended up getting in a lot of trouble for that. We see a lot of perseverating questions. Have you guys seen, what's that Ben Stiller movie, Meet the Parents? Where he's like, whatever you do when you go to the airport, don't say bomb. And then he gets there and he's like, bomb, 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 bomb. Do you remember that? Great. So that's the sort of thing we see pretty frequently. I work with this one kid named William who is so wonderful, but William has figured out that there's something wrong with his interest in making friends with young children. He can't understand what the rule is, but he knows he gets in trouble for it, and so he's constantly asking me, what happens if I talk to this little boy at the park? What happens if it's a little girl at the park? What if she's 5? What if she's 10? What if she's 6.5? And we're like constantly negotiating this, what's okay and what's not okay, and people think he's like a predator waiting to happen. He's not. He doesn't understand the rule, and he perseverates on that anxiety, okay? There's a kid named Jacob that got called in for peeping in windows. He wasn't looking at, girls. He was counting ceiling fans in somebody's house because that's what was meaningful to him. That's a behavior that his family allowed when he was 5 or 6 years old, but now he's 17 and has a really gross mustache, and people do not like it anymore when he does that. Loitering in public places. Again, loitering is really the absence of that social understanding that like, oh, I'm not supposed to just hang around if I don't have business to attend to. So that misunderstanding of social rule gets people in trouble all the time. Public versus private behaviors. There are plenty of things, I'm not gonna make eye contact with anyone when I say this. There are plenty of things that people do behind closed doors that they should not do out in the public. But that public versus private dynamic, that's a really difficult one for somebody who has a social disorder. So sometimes we see inappropriate sexual behaviors. We see misinterpretations. We get calls that somebody is high, drunk, psychotic. Those words are the kind of words where when you are arriving on a scene, I just want you to be aware that there is an alternative story that could be happening. And finally, one thing I really want you to know about, a twist that I never thought about until I started working for the Autism Society, is what if you arrive on a scene where people are critical of the person already interacting with somebody with autism? So what I'm really talking about here is parents and caregivers. I met somebody last year, and there's a great story with this, but I don't think I have time to tell it. Essentially, her son became upset at a Target, like kind of for a good reason, but whatever. He got really upset. He sat down on the ground. They couldn't get him to move. He started to like hit the ground and hit himself. He wasn't hurting anybody else, but she recognized that like they needed to get out of that Target and she couldn't get him up off his feet. What she did to give him that deep pressure that we talked about before that she knew would regulate him is she just lied down on top of him. She just literally tried to squish him. And somebody called somebody thinking that she was abusing him. Okay, so there are so many parents and caregivers who have the fear that when you all arrive, you're gonna misunderstand their intentions. And that's like a pretty real pattern. That's happened to a lot of parents that I know, all right? Okay, next I want you to think, now we're thinking about the calls. When you're arriving on a scene, I want you to remember, and this is a super hard part, not everybody's gonna disclose to you, okay? Some people don't know they're on the spectrum. Anybody older than about my age, which is roughly 30, FYI. I know I look like I'm approximately 14 and a half. It's a big day, Ellie's day out. Anyways, so, you know, somebody who is older than about my age may not have had access to appropriate diagnostic services when they were younger. They could have been told their entire life they have some sort of other disability or mental illness, or they might just be like the weird guy. Right? There are a whole lot of people that are undiagnosed. So I recognize that the best case scenario is you arrive anywhere and someone says, this person has autism, here are the things that make them tick, here's how you can help them. In the absence of that, we have to use our observation skills, which is why I talked to you about that in the beginning. I also want you to know that people do lose their skills when they get stressed. So you may be familiar with someone from your community who's on the spectrum who talks just fine, but in an emergency situation, can't respond. That's pretty common. That's something even the high-functioning people with autism, use my air quotes for those of you looking at the back of your eyelids, those people are often describing that the stress causes them to lose or change their behavior, all right? Now, we know that we can anticipate the sensory needs of somebody on the spectrum. When you approach a scene where your red flags are up, I would think from the get-go, is there anything I can do to reduce the sensory overstimulation in this situation? Do you have flashers on? Do you have a radio? You all are so immune to that radio. It's super distracting for those of us who don't have it in our ear all the time. I'm not telling you to turn it off. I'm asking if you could turn it down, or if there's more than one of you present in any given space, you know, are those sounds interfering? Because that can be really destructive to somebody who's kind of on the edge of overstimulation. Obviously, if we're working with children or vulnerable adults, we want to look to a caregiver to give us that good information. I wish we lived in a time where you could say, oh, does your loved one have autism? I do not recommend that you do that at this time because people don't handle it very well, necessarily. But you can ask questions like, I'd like to talk to him. Is there anything I need to know about the best way to communicate with him, or is there anything I should expect about his behavior? Some of those like side questions, I wish there was a more effective way to communicate with people, but I'll tell you, if you just blaze in and say, looks like this guy has autism, sometimes people Won't have great rapport with you after that, unfortunately. We're going to try to change that, though, over my career. We talked a little bit about literal thinking. I want you to think about when you give someone instructions on the spectrum. I want you to think about what you're actually saying to them. Sometimes when people with autism are doing weird stuff, it's because we told them to do weird stuff, and we just didn't realize that that's how we phrased it. I want you to be intentional when you speak to somebody on the spectrum. Choose your words wisely and say what you mean. Try to stay away from things like idioms or sarcasm, not because people with autism are too stupid to understand it. That's absolutely not true. But if you have to start on a good foot and process a situation quickly, just don't complicate the situation with that sort of stuff, okay? Nicknames is another common one. People will refer to somebody as like kid or sport or something like that, and it's like, just don't call them anything if that's the case, because oftentimes that's really distracting for them, okay? We also want to give people what we call positive directions. I'm not implying that you have to be polite to everybody on the spectrum, but I am implying that if you tell someone what to do instead of what not to do, they're going to be more compliant with your directions, all right? So rather than saying no, don't, or can't, tell them what they should be doing, and they're much more likely to follow your directions. If you can demonstrate things, that's great. In the absence of being able to demonstrate, I also want you to know about these types of alternatives. Honest to goodness, the absolute best tool I have in my arsenal when I'm supporting someone on the spectrum is a piece of paper and a pen, okay? It's not about writing a whole script, but being able to make a list, a step-by-step set of directions, or even a little bit of a story of like, here's what's gonna happen next, and then being able to work with them to say like, okay, we did this part, what is the next part? Especially if you come to a scene and somebody is unresponsive to you, they're conscious but unresponsive, using these kind of tools will sometimes break that trance of sort of being stuck because we're offering them instructions in a different way, all right? This red thing, by the way, is called a time timer for people who have poor executive function, saying, okay, we're gonna do something in 5 minutes, especially when we acknowledge that those transition times are the hardest. Can we use things like a time timer to say we're gonna be here for 5 more minutes or 2 more minutes or whatever? I just want you to know when on your iPhones or your whatever it is, if you don't have an iPhone, I don't even know what that's called, you can look up something called a kids timer, and it's totally free. It's an app you can put on your phone, and it basically, even if you can't read an analog clock, you can understand that as the red reduces, your time reduces, okay? Another good trick. In terms of your sensory environment, we already talked about how you approach someone on the spectrum. As you transition to new environments or new stages of your processing, I want you to reconsider the sensory environment. You may have to adjust it at several times if you have to. And then one more major strategy, I talked to a couple people yesterday, so I sort of threw this in at the last minute. My understanding is that some of you have relationships with your schools, where you may be interacting with people from your community on a rather regular basis through like a school resource position. This is another thing I want you to know about in general. One of the tools that we use to help people with autism every day is using things like scales and colors to help them describe things that are difficult to describe, like your emotions, like your behavior. So this is called the 5-point scale. Anybody who's seen the inside of a special education classroom in the state of Minnesota uses this scale almost every day. Okay, so I just want you to know that it exists. The way that it works is that we're essentially, hang on, I'm skipping ahead here. The way that it works is those 5 points are distributed across a curve. This escalation curve is probably something you've seen before, especially if you take de-escalation classes, for your profession. But the idea is when you're at a 1, you're calm, you're cool, you're collected, you can engage with other people. When you're at a 3, you're like nervous, excited, frustrated, overwhelmed. And when you're at a 5, you're rather out of control of your behavior. So how I use this is I say to somebody like, whoa, you are showing me a 4. Your voice is loud and you're stomping your feet. I need you to be at a 2 or a 1. What are we gonna do to get you to a 2 or a 1? Do you need to watch a video? Do you need to take a walk? Do you need to talk to mom? Do we need to sing this song? Like whatever it is, how can we get you from up here to down here? That's something that a lot of people can wrap their heads around, okay? Now the unfortunate part about escalation, and again, this is something you likely learned, is absolutely any person, autistic or otherwise, every single human, when we reach escalation that's above that like level 4 and approaching level 5, we get stupid, okay? Probably not you guys, actually. You guys are probably the exception to this rule because you have to be really smart when things are going down. The rest of us get really stupid, okay? We process language poorly. We make decisions poorly. So if you arrive on a scene or if someone becomes escalated to the extent that you would categorize them in that sort of top zone, I want you to know that the introduction of strategies, writing things down, having multiple people talk, these are the sort of things that are going to push someone over the edge. Sometimes that's inevitable. I'm not telling you otherwise. But what I am telling you is that all the strategies that we talked about work best when a person is between a 1 and a 4. If someone is to the extent that they're between a 4 and a 5, then we have to start thinking, is there a way I can control the environment before I can control the person? Now, ultimately, we're going to talk about restraints, and briefly, because I'll tell you, I'm not trained in the way that you guys are. And I'm not just talking about handcuffs, medical restraints or restraints in an ambulance or whatever. I recognize that we have to use those tools, and I'm not here to tell you not to use them. I'm here to tell you that if that's preventable, or we have the time or luxury to be able to allow people to move more freely, to address their own sensory needs, to address their own processing needs, sometimes it's easier to control the environment than it is to control the person. Now that's a luxury we don't all have, and so I do want to address this. If you do have to restrain somebody, for whatever reason, what I want you to know are a couple of things. There's a social expectation when you are restrained, which I can't speak to personally, but let's say, if I were restrained, I kind of understand, like, well, the jig is up, right? I'm restrained. I can't fight against this. I'm not going to be able to like bust these handcuffs off. That is a social awareness. So lots of people with autism who are restrained will continue and endure to fight against those restraints at the result of possible injury to themselves or escalation in a way that you don't necessarily predict. So great, you tie their hands and now they're headbanging against the seat or against the ground or against the wall. That's not good either. So I'm not saying don't restrain them, I'm saying restrain them at the risk of understanding that sometimes that doesn't de-escalate the situation, but rather it introduces a new type of escalation that can be just as hard to deal with. Okay, if you do restrain them, here's what I recommend. Remember, just like telling people what to do instead of what not to do, we want to affirm those good behaviors. We want to say, I love that you're sitting still. You are helping me so much by sitting still. Thank you for sitting still. Catch them in those moments where they're doing anything right and drop in that positive reinforcement for the thing that you want them to do, and it's much more likely than saying, stop, you can't, don't do that. And finally, regardless of what situation you're in, whether it's medical or law enforcement or otherwise, recall the importance, please, of telling your colleagues, whoever they may be, whatever the next step in that process is, tell them what you learned. Because if you went through the trouble of discovering something about that person on the spectrum, what soothes them, what helps them engage, what helps them calm down, if you learned what that is, please, for the love of all things good in the world, tell the next guy. Okay, because oftentimes what we see are spikes in behavior throughout processing in any form, because every time we introduce a new person, we're reinventing the wheel. So please advocate in whatever way you can that you have the opportunity to pass on whatever it is you figured out, because it's going to be super valuable to the next person. Okay? Now, my time is up with you today. I have one more thing I want to mention as something that we can talk about much longer at another time. The Autism Society helped develop something called the Vitals app. The Vitals app is not perfect, but here's how it works. A person, a private citizen, with autism or another disability, or a caregiver on their behalf makes a profile for a person that includes information that is useful in an emergency response. So it doesn't tell you everything about me, it tells you how to calm me down if I'm in an emergency situation. That profile is my part of the app as a private citizen. I also carry with me a beacon. You, as a participating department, right now these are related to law enforcement, but I think it's going to go to emergency medical response very quickly. The idea is you as a department participate and carry sort of like a uniform beacon amongst yourselves. You don't have profiles, you just have your department's account, okay? Now, when my beacon comes within 100 feet of one of you, that profile information becomes visible to you so that you can use it to support me. When we're out of range, when we're outside of that 100 feet, it's no longer available to you. Okay, so this is a great tool for people with disabilities because it gives you the individualized information that you need, but it doesn't allow you to track me physically, which is something a lot of people with disabilities have real qualms about. And that information is populated only with what I think is important to you, and it's not necessarily there for you to peruse at your leisure, which is another thing people worry about when they share that kind of information. So everything I just taught you is meant to serve the entire spectrum, but we know this is the sum of many individuals. This is one tool that can help you get that individual information, which sometimes supersedes whatever you might have learned in training because it works exactly for this guy, whoever he is. Okay, I'm 4 minutes over. Nobody has rushed me at the stage yet. I was kind of expecting I would get tackled at the ankles a few minutes ago. But here's the deal. I agreed to stay. I'd be happy to take questions that you might have. I have plenty of information I can share with you now or at any other date. I hope this is a good taste of what could be provided to you, and I am over the moon grateful that a conference like TZD that includes so many people from around the state from so many multidisciplinary backgrounds would agree to have this be a topic that everybody gets to listen to. This is like the best day of my life. So I really appreciate all of you for making the choice to take the time to learn this. I recognize this is one thing amongst millions that you try to keep track of as you're supporting the people in your communities. But if there's anything I can do to make that easier or more practical or better, I hope that you'll contact us because we're here to make your lives better so that people with autism can have better lives also. Okay, let's be done.